depression. And good afternoon. My name is Ashley Ferdinand, and I will be talking to you today concerning depression. Depression is considered a mental disorder. And almost 300, it is proven that as an estimated 300 million Americans deal with depression. And this was estimated in 2017, which was last year. A mental disorder is a psychological disorder that many of us face. There are various symptoms. Let's go with it today. The first one I would like to go over with is the loss of interest. The loss of interest, if you are normally active, you're normally in groups, various organizations, various, you attend parties, you're just, a social butterfly, and all of a sudden, now you're not interested, you're an not necessarily an introvert, but you go through your introvert ways or tendencies, you just lose interest in being around people. You no longer want to associate with anyone. You just, you just want to stay enclosed. That is a symptom. That could be a symptom of depression. Let's go over another one. Lack of sleep or a major increase of sleep. That's also a symptom of depression. Like I said, it's a psychological disorder. That means that it is. That means that it is a chemical imbalance within the brain, and I'm going to go ahead and that means that it is a chemical imbalance within the excuse me of my ignorance of how to spell it. Pituitary gland. Which this is the brain. Small brain, this is huge brain. The logical. You have your left side of the cranium and you have the right side of the cranium. This right here will be where your frontal lobe is. So this is the pineal gland. We all heard of the pineal gland. I'm not gonna go over that later. We have the midbrain, right here. Within that, right along that area, would be these two. The pituitary gland, the PT and the TT. Gland. And that actually sends the chemicals through the brain down to this right here, which is the thyroid gland, that also is connected to your mood swings, the symptoms, the lack of sleep, your increase of appetite, your loss of appetite. I'm gonna go ahead and put that as a symptom. Your appetite as well, that also has a major part, it plays a major part in your symptoms of the depression. Being that it is a chemical imbalance, a lot of doctors would like to prescribe medication. There are all sorts of medication for such disorder or mental distress. Lexapro is one. Which I hardly would recommend. There are various substances. I do not advocate substances. I do not advocate substances. I'm not a substance advocator, nor am I a substance taker. Yes, I have been diagnosed with major depression. If you take a look at my previous video shows that, and tells, I should say, that I have overcame and been suicidal. I have attempted suicide due to major depression. These are just a few of the symptoms of depression. I'm going to erase it now. Continue. Forgive me because I don't have an eraser, so I think it's a dry erase board. How many people do you know that suffer with depression? I think everyone in here knows that someone, if you do not struggle with it yourself, I think you do know someone who does. It's one of the most common mental disorders and also the most controversial one as well. Go ahead and erase the brain. So like I said, depression is a psychological disorder, or you can say it's a mental. This is the most common thing that people use. Common phrase. The most common phrase is used. What is sad to me and what I do not like is the simple fact that most people have a tendency to stereotype. So what are some stereotypes that you've heard about mental patients or mental diseases or mental disorders? One stereotype is that the most common that I've heard is that you're crazy. You're crazy. In the Black community, there is so much of ignorance concerning mental disabilities, mental disorders, mental illnesses, mental challenges that is just unreal. And one of the major misconceptions is that you're being labeled as crazy. Or retarded. Retardation. That is the most common that I've heard. Another stereotype is that you need to take medications. Being that I'm really not an advocate of substance intake, I put number 2 down because of the faux pas, if you will, that you hear. Well, she hasn't taken her medications, or he needs to take his medications, as if it was in a negative connotation. Could you move that for me? So this is the second stereotype that when it comes to mental disorders or disabilities. Another stereotype. You will never be normal. That's another stereotype, another thing that is commonly uh, perceived to someone with a mental disorder, that you would never be normal. My thing is, what is normal? What is normal? What is normal? What may be normal to you may not be normal to me, and vice versa. What may be normal to myself may not be normal to you. For instance, let's say that my normal is waking up at 5:30 in the morning, Monday through Friday, taking my dog for a walk outside in my neighborhood, and getting ready for work, having the kids out on the bus, and being at work for 9 o'clock. That's normal to me. Anything outside of that, any person that is outside of that box that I've created is not normal. Let's go over here. I don't know if that's the word non-normal or not normal. So, what is not normal? What isn't normal? What is abnormal? Thank you. What is abnormal? Abnormal is the opposite of normal. That is something that is not. That is something that I can't relate to, something that's not relatable, something abnormal. Dysfunction. I can relate to dysfunction. My family doesn't fight, they don't argue. My family, gets along very well. Dysfunction is abnormal. All these could be related and could cause depression. Dysfunction, honestly, economic status, that could cause depression. Where you live at, your geolocation, your geographical location, where you live, urban areas, rural areas. All those could play a major part in your depression, in your dysfunction. Your marital status, single, or widowed, single or widowed, or even some people say, shoot, even married can cause dysfunction, which can cause depression. education, your educational status. Not enough education. And I'm going to start, because you can't really see that, so I'm going to start. Not having enough education. Not being educated enough. That can cause depression, right? Yeah. Not being educated enough, or sometimes being too educated. Sometimes we can be too educated, and I'm saying that from hearsay because I don't have that. I don't have that problem right now, but I do know that sometimes it can be stressful and it can cause depression if you can't find a job because you're overqualified. People don't want to pay you depending on your geographical location. People refuse to hire you because they know that you are well qualified and more qualified for the position that that you applied for, and for whatever reason they cannot accept you. We're still talking, speaking about depression. And I'm not going to be long today. Just a brief preview, excuse me. Let's speak, I want to give you a couple of definitions, okay? So what is mental disorder? And I quote, a mental disorder is the behavior or pattern that occurs and is associated with present distress or disability, or with significant increased risk of suffering, death, pain, disability, or an important loss of freedom. When I read that, stood out to me. It stood out to me because loss of freedom. Distress. What is distress? Have you ever heard of the word distress? Distress. Distress is extreme anxiety, sorrow, or pain, torment, heartbreak, or heartache. We're talking about mental disorder. And this is all that I will touch on today. So the next time you hear someone making fun of someone else because they have been diagnosed with a mental disorder, realize there are several levels, there are several disorders, there are several symptoms, there are various reasons as to why this person has been diagnosed with such. And because of that, it is my belief that we should treat each other with the kindness and respect that each other deserve. Last but not least, I would like to touch bases PTSD. PTSD is the post-traumatic syndrome disorder. So, stress, I'm sorry. Okay. Stress disorder. All this plays a part in your things that you experience. So with that being said, this is my time, and thank you for your time.